Hello, today I would like to introduce 3D titanium membrane, OssBuilder. OssBuilder is designed for cases requiring extensive bone regeneration, and for situations where stable space maintenance is essential in large vertical or horizontal bone defects. It can be effectively applied in challenging cases such as dehiscence, perforation, vertical defects, and combined bone defects, where conventional approaches often fail to maintain sufficient space. First benefit is excellent space maintenance. OssBuilder is made of biocompatible grade 4 titanium, which provides outstanding resistance to external forces. When firmly secured to the implant, it maintains the bone graft space in a highly stable manner. In particular, it enables space creation even in severe cases with more than 10 mm of vertical and horizontal bone defects, where implant placement is typically difficult. In addition, its rounded design allows stable fixation to the alveolar bone, maintaining its shape without deformation even under external pressure. Second benefit is simple and convenient usability. First, OssBuilder offers a diverse lineup to address various defect types. With 1-wall, 2-wall, and 3-wall configurations, it can be applied to buccal, proximal, and lingual defects depending on the clinical situation. For severe bone resorption cases, OssBuilder 3 can be used to secure a larger regenerative space. Also, unlike conventional titanium membranes that require cutting or bending, OssBuilder features an ergonomic 3D preformed design, allowing immediate application without additional modification. This significantly improves surgical convenience. Furthermore, it can be fixed without bone tacks, and removal is simple, as it can be done by detaching the cover cap without additional fixation screws. This reduces surgical complexity and patient discomfort. Lastly, depending on soft tissue conditions, either a cover cap or a healing cap can be selected, allowing flexible application in various clinical situations. The overall procedure is straightforward: implant placement, anchor fixation, bone grafting, OssBuilder placement, cover cap or healing cap connection, and suturing. In summary, OssBuilder provides both stable space maintenance and simplified surgical workflow, making it an effective solution for complex bone defect cases. This concludes the introduction of OssBuilder. Thank you.